Hello, this video will review our custom insulin infusion advisors. We created these advisors in order to help improve inpatient insulin management for hyperglycemic states. Our team is pleased to report that these innovations were recognized with Cerner's 2015 Intelligence Connect Award. All of the solutions we will demonstrate today are in production domains at multiple facilities and have led to improved outcomes, primarily reduced hypoglycemic episodes. Our insulin advisors help physicians and nurses effectively manage complex inpatient hyperglycemic states in an evidence-based manner. Using the mPages platform, we were able to build 4 robust advisors. The first and second are diabetic ketoacidosis, DKA, and hyperglycemic hyperosmolar state advisors, or HHS. These are based on American Diabetic Association guidelines. The third and fourth advisors are post-cardiac surgery and critical care insulin infusion advisors. These are based on the Portland Protocol. These advisors have helped standardize and improve care for patients with these conditions at multiple facilities. Let us start with demonstrating functionality of the post-cardiac surgery insulin infusion advisor. We have a 55-year-old male who underwent an elective cardiac bypass surgery. He was started on an insulin infusion intraoperatively due to hyperglycemia. The patient was transferred to the ICU in a stable condition on an insulin drip. The ICU nurse is about to initiate the post-cardiac surgery insulin infusion advisor based upon the order from the CT surgeon. The order can be placed either by clicking on the advisor folder on the home screen or by typing in post-cardiac surgery. Once advisor opens, patient data is available for review on the right side of the screen. This includes patient's weight, vital signs, relevant labs such as basic metabolic panel, and diabetic home medications. The protocol content can be accessed by clicking on the top right-hand corner question mark symbol either by the clinician or the nurse. The same protocol is also available on Forms on Demand for users to be able to use during unforeseen downtime. The clinician is required to answer 1. The patient's home diabetic treatment regimen, as the advisor accounts for patient's prior exposure to insulin, and 2. Preferred mealtime subcutaneous insulin choice to account for postprandial glucose elevation caused by meals. Once these are answered, sign the advisor. Notice that the table of contents now displays the advisor for the nurse. Notice the change in color on the table of contents since a new point-of-care glucose has been resulted. Once the nurse clicks on the advisor launches and displays the previous glucose, the current glucose, and most recent insulin drip recommendation. If the insulin drip rate is not current, the nurse can exit the advisor by clicking the Exit button and update the rate in iView. The nurse has to validate previous glucose value for the Confirm button to be displayed. Once confirmed, the nurse is presented with insulin titration change and a prompt for additional bolus. The nurse then continues to sign the advisor and proceed to care for the patient by following the recommendations. In between new glucose results, the nurse can always access the most recent recommendation made by the advisor by clicking the advisor from the table of contents. For patients with an active non-MPO diet order, Chart Meal button appears within the advisor. The nurse then proceeds with clicking the Chart Meal button to document the type and amount of meal consumed by the patient. This prompts the advisor to make a subcutaneous meal recommendation to account for postprandial hyperglycemia. Note that this is in addition to the IV insulin infusion recommendation. The nurse proceeds to manage the patient on an hourly interval and occasionally at 30-minute interval depending on change in blood glucose value. Once the patient is clinically ready to come off the insulin infusion, the advisor order can be discontinued by accessing it from Medication section in the order profile. All orders placed within the advisor are displayed in the patient's order profile. The clinician should use clinical judgment to discontinue each order as indicated once the patient is ready to be transitioned off the advisor. Critical Care Insulin Infusion Advisor functions similarly to post-cardiac surgery except for the target glucose range. The target glucose range for post-cardiac surgery is 110 to 150 milligrams per deciliter, And for critical care insulin infusion advisor, the target is 140 to 180 milligrams per deciliter. This concludes the demo.